Hello, hello, hello. We're here on a Monday evening for our final book chat of the year. Hello. So we're here for our final book chat of 2024. Dr. Blackstock, I think she's here. Hi,
Okay.
how are you?
I'm good. How are you?
I'm doing okay. I think I'm coming down with something, so I'm trying to get ahead of it.
Okay.
Yes,
Make sure you get some rest after this.
for sure, definitely. I'm so happy to um, end our year of reading with you and this amazing book. Um, Everyone should read it. It is incredible. And I've had so many people like in my DMs thanking me for selecting it and then just talking about their feelings and their reactions to reading the book.
Yeah.
Yeah,
Yeah,
it's very special.
thank you. And I really appreciate you choosing Legacy for November book club because for me I wrote Legacy for a very broad audience. It's not just for people in healthcare, not just for people in medicine, right? It's
Hmm.
for all of us.
Yeah. So I'm going to do like a little brief opening. And what I would like for you to do is just tell us a little bit about yourself and then we'll just dive right in.
Okay.
Okay. So, hello, everyone. I'm Jamise over at Spines and Vines. I'm the founder of Diverse Spines. And this is our final book chat of the year with Dr. Uché Blackstock. And her book, Legacy, was our November read. This is a non-spoiler conversation, but if you have not read this book, I highly, highly recommend that you add it to your to read list. Try to get it in before the end of the year, but if not, definitely for your 2025 list. And so, welcome, Dr. Blackstock, and introduce yourself and tell us a little bit about you.
Thank you so much for having me. So, as you said, I'm Dr. Uche Blackstock. I actually am right now in Brooklyn, where I was born
Oh,
and raised. That's where I live now. But I am an emergency medicine physician by training. I also founded an organization called Advancing Health Equity almost 6 years ago. I left my career in academic medicine to start this organization dedicated to dismantling racism and bias in medicine and healthcare and to improve health outcomes for Black patients. So that's kind of what I do. And then I'm also the author of Legacy.
awesome. You know what? I really enjoyed people hear me say this all the time because I love audiobooks, but this audiobook was also very, very well done.
Thank you so much. I really loved recording the audiobook and um, it actually was so natural for me to tell my story. I remember the audio engineer and the director, they were like, "You did such a great job. You've never even practiced before. You just came in here." I said, "But it's my
It's
story."
your story, right? So, of course, you're going to know. Yes,
Yeah.
absolutely. So I want to talk about, before we jump into the book and the reason why you wrote the book, but can you tell us a little bit about the organization that you started, Advancing Health Equity, and how was it for you to make the switch to leave, academia and to go into do this journey?
I feel like I've been in a position I think that many of us have been in where, we're in these work environments where we, as Black women, as women of color, we're not really taken seriously, we're not appreciated and valued. And so I'd come to this realization after several career disappointments that I need to leave academia, that
Mhm.
I really need to be able to do this work very authentically and in the way that I wanted to do it. So I took this very scary leap. I say it's a scary leap of faith in myself to
Yeah.
leave my faculty position at NYU School of Medicine, where I, again, was just a very toxic, sexist, racist environment, to start my own company because I was like, y'all you just want to be performative about DEI and health equity. And I can't like look at myself in the mirror every day and be proud of the work that I'm doing if I'm doing it with those kind of constraints. So I founded Advancing Health Equity. Initially, it was just me, and I was working with health and health adjacent organizations. So initially I was doing training, so anti-racism trainings, DEI
Mm-hmm.
training. And then, of course, soon recognized that trainings only help so much. So then we started doing assessments. So going in, doing organizational culture assessments, interviewing people, focus groups, in surveys, and then working with companies to develop and integrate DEI and equity into their strategic policies, strategic plans, rather. So just to how to operationalize it.
And so this was also not only in the medical field, it's just companies in general.
Yeah, and health related companies.
Okay. Yeah. Which is very much needed. Absolutely. I
Yeah.
find myself like, that's my disclaimer at the very beginning when I'm going to see someone is like, my pain tolerance is high. I mean, it's not high. And I feel like I have to read this whole list of stuff that I care about to advocate for myself before I even get started.
No, I know. And the thing is, guess what? I feel that way too. And I'm a physician, and I'm a physician.
Yeah, definitely. So let's talk about legacy. What inspired you to write legacy?
So,
And
yes, go ahead.
and what's the connection to both personally and professionally? I know this, but I don't know if our audience knows this. But
Yes,
I
so
want to hear you say it. Talk about it.
legacy has a double meaning. Actually, people tell me now it has a triple meaning, but legacy has a double meaning. It's about, the legacy of being a second generation Black woman physician, which is something that's very rare to say. Less than 1% of all physicians are Black women. My mother was the original Dr. Blackstock. She grew up about 15 minutes from where I am right now here in Brooklyn, under very different
Mm-hmm.
circumstances. I'm public assistance to a single mom, just had a very difficult childhood, but was the first person in her family to go to college, and then had a Black chemistry professor who encouraged her to apply to medical school, and she did, and she ended up at Harvard Medical School.
Awesome. Yeah.
There, she was a fish out of water, could have gone anywhere afterwards, but came back and practiced in her own community, which she grew up in. And so that's the lesson that my twin sister, Oni, and I learned from a very young age, that you can still go off to these institutions, but come back and work in service to your community. And so our mom passed away, I write about it in Legacy, when we were 19 years old. She had acute leukemia. She was only 47. That's the age. I just turned 47 in November.
Mm-hmm.
And when I think about my mother and everything that she went through, just being the first person in her family to go to college, to medical school, and have to navigate a career in medicine without really any support. It wasn't something as a 19-year-old that I could appreciate, but I wanted to pay homage to her, as
Mm-hmm.
well as the other Black women physicians that I grew up with as a child. So that's one legacy. The other legacy, obviously, is the legacy of systemic racism in medicine, that a lot of what we see today in 2024 in terms of just the poor health outcomes for Black Americans is due
Mm-hmm.
to deeply rooted, myths about Black people, deeply rooted racist practices. And so I wanted to also give an opportunity for people to help them connect the dots for why we, see here in 2024, myself with my Harvard undergrad and medical school degree, I'm still 5 times more likely to die of pregnancy-related complications than a white woman with an 8th grade education. So
Mm-hmm.
that's the legacy, right? And so the third legacy now people are telling me is that I was able to carve out and navigate this journey for myself that was off the beaten path, in terms of I left my career in academics
Yes.
and said, I want to do things my way. I want to make a difference my way.
Mm-hmm.
Um, and so the book ties all of those things together. But what I want to tell people also is that, I left my job in December of 2019. I didn't know what 2020 was going to bring, but I stayed the course. Like, I left my job. I worked part-time in urgent care, part-time on my company. And I started seeing in March of 2020, working here in Brooklyn, we were the epicenter of the pandemic. I started seeing my patients were coming in sick with
Mm-hmm.
COVID. And I noticed that my population of patients was browning. Like, they were just, it was Black and Latino patients. And I said, I got to write about this. So I wrote my very first op-ed about racial health inequities in the pandemic before the third week of March, because I said, I don't have the data, but I need to write about this. And so I became one of the first voices in the pandemic to talk about how racism would make COVID disproportionately impact our communities. And my literary agent started following me. She read up on my background, and she heard me on a local NPR show one day and just cold emailed me and said, "You have a story to tell, and you're the only person to tell that story." And I think that's the case for so many of us. We do. We all have our stories to tell.
And so that's how the book came about? Wow. Wow.
And that's the other piece where, I was so used to being in environments where I know you would look at my background and say, "Oh, girl, you got so much going for you." But of course, you you internalize anti-Blackness around you, and so I never thought I could write. That was never even on the list of things I thought I could do. But sometimes when you're doing the work that's in alignment to what is important to you, your purpose, your values, the people who see it, the people who need to see it, they appreciate it, and then opportunities and abundance flows.
Yes, it's such an important book. For people that are coming in right now, we're talking to Dr. Uché Blackstock, and the book is Legacy: A Black Physician Reckons with Racism in Medicine. So let's talk about that. You address systemic racism in healthcare.
Yes.
And so how has your family legacy shaped your understanding of these issues?
Yeah, so it's interesting because, I write that when I was growing up, I thought that all physicians were Black, and most of them were Black women. All who I was around, I didn't recognize that I was having a very rare and unique experience. But were Black women who lived in the same neighborhood that they were practicing, working class neighborhoods, middle class neighborhoods that were caring for patients that look like us.
Yeah.
So I feel so fortunate to have been able to see that at such an early age. And being able to see that, it was very easy for me to say to myself, I can be that too.
Yeah, but also seeing that, would it not like give you a vantage point of knowing how care should be to Black people and how they should be treated? Can everyone hear okay? Am I echoing? I'm hearing like a crackling sound.
No, you're not
Okay,
echoing.
Good. All right. Sorry. Okay.
You're not doing it at all. Yes. So it's interesting because, my mom would come home from work, talk about some of the experiences that she had at work. Oh, someone is saying lots of clicking.
Yeah, that's what I'm hearing. Is it a microphone?
I don't have a microphone.
Yeah, I don't know what the clicking is.
You hear it on my side?
Huh. Let me see. Okay. Is it still clicking? Better. I don't hear it now, but
Okay.
I do hear the clicking. I don't know what that is. Okay. Let us, somebody says sounds good. It's in and out.
Okay.
Really? Sorry, guys.
Is it
Okay.
rings? No.
No, it wouldn't be your earrings.
Sometimes I'm very animated when I speak, and so my earrings may start.
Yeah, but you're not using a microphone, so it's like not. I don't know what that is. It's interesting. Somebody said it's okay. I was ignoring it. Okay, well, let us know if you can't hear clearly. We'll have to come out and go back in, and I don't want to do that because I don't want to break up the conversation. So
On video.
yeah. So you guys let us know if you want us to come out and come back in, and we'll do that. But if we can keep going, let us know. Give me a thumbs up. I don't know what's that coming from. Somebody says,
"Wait, what does it sound? Is it like a click? What is it?
it's like on my end, every time I'm starting to talk, it's like there's another person on the line. Let me check.
Like a phone.
Yeah, it's weird. Hold on a second. Yeah. Okay. Well, let's keep moving.
Okay.
So we were talking about like your vantage point and what you saw from your mom. And
yeah. I have to be honest with you. It wasn't until I was older that we started thinking about the patient perspective. I just knew from my mom's perspective that she was able to relate to her patients in a way that other physicians weren't, because she came from the same, not just background, but the same community that they grew up in.
Mm-hmm.
It was like family in a way.
Yes. Yeah.
It wasn't, you know, we recognize there between physicians and patients, there's this power dynamic. And what I noticed with my mother's patients is that they saw her as almost like a family member. Just the way they interacted with her was very warm and caring, and vice versa type
Yeah.
relationship.
And so in the book, you go through history and talk about the things that have enabled this or allowed this to continue. So let's unpack that for us. Like, why is it like that? If you're new into medicine, right? You're fresh out of when do they start like ingraining certain things into students? Because you're going into this field to work with patients, to help people, to save people. And so how does the racism kind of bleed into it? Oh, we're frozen now. Well, I don't know what happened, you guys. She got kicked out. Okay, let me let me don't know what happened. Interesting. Let me invite her. Okay, let's see if we can get her back in. Are you guys still there? Can you give me a thumbs up if you're still in the audience? I don't know what's going on with Instagram. Okay, let's try this. Let's see what happens. Thanks, Jill. I'm trying to get her back in. Oh, there she is.
Can you see me?
Yeah, I don't know what happened. Oh, she's gone again. Okay, let's try. Oh, they don't want us talking.
Can you see me?
Yes.
That is so weird. I think there's something going on with Instagram.
I was like, do they not want us to have this conversation?
I know. But you know what's weird? I can't, there's something over my face now. But as long as you can see me, like there's a request to be in this. I kept requesting. It's okay. Let's just keep talking. It's okay. It's
I
okay.
can
Don't worry.
see you. Can everyone see? Let us know in the audience if you guys can see. Okay, that is the weirdest thing. Like I was talking and then you kind of went away and then you came back and you were frozen. Okay, so let's talk. Let's unpack the systemic racism. Like, where do you think it begins? When did it become ingrained into new students that are going into the medical field?
Yeah, I mean, so I think when we look back at a lot of the historical pieces, a lot of it was from
Mm-hmm.
slavery. So the fact that so many, like that enslaved people were being used in medical experiments or to make discoveries. And so I know there are people probably on the line who know about J. Marion Sims, the father of modern gynecology. And the thing is, he was someone who was very revered by the medical establishment. So you had these individuals who were very well respected, but who were doing these things that were absolutely horrific.
Mm-hmm.
So making discoveries, for example, J. Marion Sims, he discovered or invented the vaginal speculum, which is that tool that's used during gynecological exams to examine the cervix. But he experimented on enslaved Black women who could not give their consent, and then
Mm-hmm.
even when local anesthesia was developed, did not use local anesthesia, and so performed very, very painful surgeries on these women. But this is just that's one of many, many stories. And so I think it was such a part of
Yeah.
medicine, right? That even later on, when schools were integrated, right? The fact is that this idea of using Black people as experiments, it stayed, and this idea of we call it biological essentialism or
Mm-hmm.
racial essentialism, right? This idea that Black people are of a different species or less human. And so we see that even if schools, like when I was in school in 2000s, you know, no one explicitly said that to us, that Black people, you know, are less human. but there were the ways that we were treated. I mean, sorry, the way the topics were covered. So, for example, that there are different kidney values for Black people and non-Black people, right? And that's
Mm,
based on the myth that Black people have more muscle mass
yes.
than white people, right? And so, but that, and we see actually what that damage, that what that's done, it actually has led to Black patients being delayed for referral to kidney care. They have not been placed on the kidney transplant list when
Mm-hmm.
they were supposed to be. So even last year, the National Kidney Foundation went back and reprioritized 14,000 Black patients
Mm,
because of that formula,
yeah.
saying that they call it a race correction factor. So we see how these myths become part of how people practice,
Mm,
right? And it becomes almost validated by that kind of practice. And then it goes on to harm individuals and
yeah,
communities.
it definitely does. And so you talk about how, you said how you were treated and things of that nature. I've had people to tell me, things like subtle microaggressions that Black people's skin is tougher, um, things of that nature. And so, what do you think? How are you working to dismantle all of this? I mean, the book is a great start. It has so much information, but what is your advice to like incoming students, or just we'll get to the patient advocating for themselves, but just what is your advice to like incoming medical professionals?
Yeah, and actually, so a lot of the work that I do with my organization, Advancing Health Equity, we work with medical schools around their curriculum. Like,
Mm,
what are you teaching the students? What are you saying that has happened historically? How are you correcting those harms? Also, there's a faculty development piece to it, because the fact is that many of these faculty have been doing this, teaching a certain way for decades. And so
yes.
it's also about educating them as well. They don't know what they don't know. And
Hmm.
so it's about revising the curriculum, updating the curriculum so it fully tells a story that's accurate, right? It's preparing our students to work with a diverse patient population. And, I write about this idea of racially concordant care, that we know that Black patients, when they're cared for by Black physicians and clinicians, they actually receive better quality of care.
Yes.
Now, I think it's wonderful, but I don't think that should always be the case. I think anyone should be able to provide quality care
Hmm.
to all patients,
I
right? But
agree.
I do
Hmm.
think, I know you mentioned that we'll get to like what patients can do. I think the burden is on our systems. So how physicians, nurses, and other clinicians are educated, that needs to be addressed. I think you asked about students. When students go into school, what's the advice I give to them? And one, I step back and say, like, it shouldn't be their burden, like, especially
Hmm.
Black students and students of color, to like fix a broken system. But I see, and I write about it, they have brought attention to a lot of these
Yeah.
issues in the curriculum. I think for white students, it really is their obligation to recognize these issues, that these issues exist, right?
Hmm.
They should be working with their peers to make sure the schools are educating them properly. Like, I think it's a moral obligation, if you're going to go out and practice medicine, right, or be a physician, be a nurse, right? You have to be prepared to work and care for different patient populations.
Yeah. I think back to when you were talking about how, they use Black people as experiments, right up the road from me, John Hopkins,
Henrietta Lacks. Yep.
Henrietta Lacks, yeah. Or taking people off the street, you know, people would go missing and you later find out that they were being used at the hospital. And so, I think things of that nature heavily, heavily contributed to, how we've been treated by medical professionals.
Yes, and even like I write about it in the book, but I don't get into it too much. But even the grave robbery, like going
Mm,
robbing like graves of free Black people, enslaved Black people, and then doing experiments on them. And actually, I don't know if you saw this article a few months ago in NBC News. One of the university systems in Texas actually had taken the bodies of unhoused men. They're mostly mentally ill Black men this year, and had taken them and used them as cadavers in an anatomy lab, and the patients' families weren't even told.
I did not hear that, and that is absolutely awful.
Yeah, so it's still that's why like we really need to keep talking about these issues because it's still current day to day. I think also healthcare systems and hospitals need to be held accountable. So it's not just about surveying patients and saying how was your experience, but they
Hmm.
really need to keep track of, is there disparate treatment that patients are receiving. So like my company, we have worked with hospitals and ERs, for example, where Black patients have waited 80 minutes longer to be admitted to the hospital than other patients. Or there are discrepancies in how pain medication is being prescribed to patients. And so we need to have all of those metrics and data that we keep track of that needs to be included in it.
Yeah. And then also too, I mean, I know I'm noticing how hospitals are coming, being bought by corporations and things of that nature. And so they're like not, there's hospitals not in neighborhoods that need hospitals. So can you talk a little bit about that and how that also affects Black and brown people's health?
You and I think this move towards like these big. I know here, like I live in New York, in New York City, and you have these big hospital systems. Like hospitals are buying
Yeah.
hospitals. We have private equity firms that are buying out, private practices, and we know that hospitals already don't have a great reputation in terms of like we don't see them as places where we can get respectful and dignified care. And that's why I thought in 2020 and 2021, when we had the vaccine rollout and they were saying you have to go to a hospital to get your vaccines, I was like, no, 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 no. That's not how it's going to work for our community because we really need a community-centered model of care. We find
Hmm.
that when there are community clinics and community-based organizations, they already have a previous relationship with
With the, mhm.
with the community members. They're trusted messengers. And so what we see is a move away from that. We see a move towards hospitals, these big systems, and that doesn't do anything to engender trust in that relationship.
Mhm. And so let's talk about, we're, of course, we see in the news too much, Black women dying, childbirth, um, and talk about, advocating for yourself as a patient.
Yeah, so this is another question I have a hard time answering just because I feel like the burden should be on the
Yeah.
system, and I don't want us to have to feel like we're going to war when we are seeking care.
Hmm.
Like that hurts my soul, but we have
But we
to.
are putting on, I mean, I know I do. I mean, I remember giving birth the first time. You actually go in. I mean, I'm young. I'm giving birth. I'm married. I'm having a baby, and I don't even think about those things.
Yeah.
I remember not thinking about it, and then having a medical emergency. And so it wasn't until then that the care. I thought I was saying something was wrong with me, but everybody was, fawning over the baby and not really, I said I didn't feel a certain kind of way. And then not recognizing that the amount of blood that was lost caused me to pass out.
Yes, and what you sharing what your experience is such a similar experience for many
Hmm.
Black, and
Yeah.
especially um, you know the blood loss.
Yes.
One
Yeah.
of the major causes of morbidity and mortality around birthing, as you know.
Yeah.
And when we step back and we look at these issues, right? It's about, like you said, the patient not being listened to,
Hmm.
and a system that doesn't center the patient. And so that's why I always say this, that you should never go to the hospital by yourself. And I feel,
Never.
and to have to say this as a physician,
Hmm.
if I can help, I bring somebody with me also. I don't know if you saw, there was a viral TikTok video earlier this year of a white male physician who said, I want to know why my Black patients always have someone on FaceTime when I come into the room.
I did not see that.
And everyone's like, sir,
Do you not
because
understand?
yes, because they probably don't trust you or they don't think you're going to listen to
Yeah.
them. So I'm not saying, definitely not saying you should go in and record your doctor or whoever. You should always ask permission, but you should also always just bring a loved one,
Mm-hmm.
like an other, a good friend there, even if just for moral support. But also, when you're not feeling well, you're not yourself. And
Correct.
so maybe on your behalf, they can ask questions or just be there for surveillance purposes. But I also say that you should always write down the symptoms that you're having, how long you've been having the symptoms, what makes them better or worse, what
Mm-hmm.
have you noticed in terms of the pain intensity. Have as many details as possible, because often when you're there, you may forget. And I think also the other thing is to really ask the clinician, what do you think is going on? What is your plan for me? What
Yes.
is my follow up? What are red flags that I should return for? You know, like these are all the things that it's not a one-way street where the
Mm-hmm.
person's asking you questions. You need to ask them questions as well.
Yeah, I think for so long it's been, I don't know, I guess my experience has been like such a trust experience, but reading this made me actually, I mean, I knew 30 years ago that it was dire, but it just really, I think, made me realize how dire my situation was when I go back and think about it, because everybody was rushed out, the mask went on. I mean,
So you
it
know
was,
what is going on,
I
like
mean,
they were when they
I was very much like, I feel hot, I'm thirsty,
mm,
and that's the last thing I remember. So they said the blood pressure plummeted, oxygen had to come on. So it was all these things, and then they told me what had happened, as far as the blood loss. So those things, I just really wasn't thinking about it at 20 something years old, going to have a baby.
right, and you shouldn't have to.
Mm-hmm.
And the fact that now 3 decades later that we're actually see even worse. It's
Yeah.
even worse. And I don't get into it as much in the book, but it's actually worse for all racial demographic groups in this country. The maternal mortality.
Mm-hmm.
Even white women compared to white women in other high income countries are not
Yeah.
doing well. They're dying around pregnancy. And so it's because we have a system that doesn't center the patient.
Mm-hmm.
And so many deaths are actually in the postpartum period after you give birth.
Yeah.
And because we have a system where you just get one visit,
Yeah.
a lot gets missed.
Oh, one visit, correct. What role do you think storytelling plays in advancing equity and justice in medicine?
Yes. It's so I think, and I see this for legacy,
Mm-hmm.
that being able to tell my story, my mother's story, is a way for people to connect these larger systemic issues to individuals, to human beings. And I think that a lot of times when we talk about these larger issues, sometimes people just they tune out because they can't really apply it. So I think the storytelling piece is very important to connecting people and helping them understand these issues that unfortunately a lot of time we're just talking about them in our silos, like within medicine,
Yes.
right? But we get these messages out to the public as well.
Yeah. Is there, like, what's your focus like on things that if you could just like change it, like what is your focus, like what are you centered on changing? I guess like one policy
Yes.
that addresses inequities that you discussed in your book.
So I think for me, what I want us to think about health is not just about access to healthcare. So there's that piece where, yes, I want to make sure that everyone has access to culturally responsive care,
Mm-hmm.
right? And quality care at the very minimum. But we know that that isn't the only thing that will change health
Right.
outcomes. That when you look at, how systemic racism has essentially deprived our communities of resources, that mirrors health outcomes.
Yeah. Yeah.
So when we look at education, housing, redlining, employment, all of that impacts our health. So I would love if policymakers could have a more holistic idea of what brings good health. That it's,
Yes.
yeah, that definitely we need more green space in our communities. People need places where we need cleaner air, people
Clean
where they
air.
can exercise.
Yeah.
All of that makes a difference.
It does. It definitely makes a difference. I mean, clean air, clean water, that's your right to those things
Yes, at a minimum. At a
at a
minimum.
minimum. At a minimum. Um, so what are you writing another book? Is what my next question. We need more, definitely need more. Like, what are you working on?
So it's interesting because, well, I'm learning so much about being an author, and I don't know
Hmm.
if this has probably come up with other authors.
I've wrote a book and I understand what you're saying. Like, I never intended on writing a book. I don't know if I'll ever write another one.
So if you had asked me, and maybe because the book came out in January, if you asked me in April, I would say, hell no.
Right.
No, but now I definitely am working on a second book idea,
Good.
because I know it's just so critical for our voices to be out there. But
Mhm.
also the other thing is what I didn't realize about writing a book is that writing the book is just one part of it. The other work is like promoting the book and
Yes.
getting out there and talking about the book, and
Yes.
also for Black authors, I feel like there's also so much that we have to do on our own
Hmm.
that I didn't know.
Yeah, you do for sure. Um, it's a different promotion engine,
And
definitely.
I've
It,
had to get comfortable with promoting myself and the
yes.
book
Yeah.
because I believe,
I mean, you've done a fantastic job. The book is everywhere. I mean, what's some of the accolades? Time 100, right?
yes, yes, Audible,
Amazon Best Book.
yes,
Um, what am I missing?
and Audible best
Audible.
fiction, yeah.
When I saw that, I was like, yes, that's without question. That's definitely a great audiobook.
You know what? I that one I'm most proud of because narrating the audiobook was truly speaking truth to power.
Hmm. It had to be very, very powerful. Like, you're speaking your words about something that is so important that affects so many people. Someone in the comments said that you taught them so much. I mean, it's just like,
Thank you.
it's such it's a, I have told everyone that they need to read this book. It's like, it's a gem. It's like, we definitely need these words.
Thank you. And I also wrote it first and foremost to validate the experiences that we have. You know, I wrote it about my experiences as a
Mhm.
patient, being misdiagnosed with appendicitis and literally as a first year medical student almost dying
Yeah.
because I was turned away from the ER almost 3 times.
Hmm. And I mean, that's like common. And so I know one of my friend, Mika, she had such a reaction. She read the book in a day and she's like, I feel so valid. I feel heard,
Yes.
and so that's what we want.
Yeah, I want us to not feel like we're being gaslit, but it's really happening. Like other
Mhm.
folks are trying to gaslight us, but it is happening, and that's why the last chapter, the call to action, was really important for me because I was like, okay, I'm gonna pour it out here on this paper about what these institutions and health systems and policymakers need to do because you cannot read this and then say, I don't know what to do next for those folks in power. I'm gonna
Yeah.
tell
And so that was my next question.
you.
How has the medical field, people in power, institutions, how have they responded to your book?
You know what? It's been overwhelmingly positive, but I have to tell you, my health equity journey started in earnest in 2020 when the pandemic hit. I was doing the work before that.
Hmm.
I kind of we're back there. We're in a sort of with 2024 with with the new federal administration, the new president, um, the backlash over DEI.
Hmm.
So I was even I'm going to be speaking at a conference in February of universities and educators where they choose common read books, and I'm going to be talking to people whose offices are being defunded, and they
Mm.
have to think about how can I get this book into our classroom.
Yeah.
So it's interesting because now I feel like, especially with the health equity work, we've already seen like CDC pulling back and saying, okay, we can't do that grant because we're using the word racism.
Yes.
So I feel even more so that that legacy and the work that I'm doing is even more urgent now than ever before.
Yeah. Because so many things are going to be rolled back.
Yes.
Hmm. and the way money is dispersed and things of that nature, you will not get those qualifying factors.
Exactly.
Yeah, definitely. So there is definitely work to be done. I thank you for this book and thank you for your work.
Thank
I
you.
do have to ask you one question
Yeah.
though. One more before I let you go. What are you reading? Like, what do you read? What are you reading?
What do I read? I get so many books sent to me.
Okay.
Which is the one I'm reading now? Oh, I'm reading one by one of my good friends. It's nonfiction. It's called Stop Waiting for Perfect by L'Oreal Thompson Payton. She's a Chicago-based author. It's about getting out of your perfectionist kind of, culture.
Oh, that sounds, I read a lot of nonfiction, so
Yes,
that sounds like something right up
yes.
my alley
Stop
for
Waiting
sure.
for Perfect.
Awesome. This has been a fantastic conversation. I could not think of a better book to end our year on.
Thank you.
Thank you for saying yes.
Of course.
Yes.
You
And so I'm sure we'll circle back around when the next book comes out. And
send
so,
goodbye. Please send all
yes,
those.
good vibes. And so, yeah, so to the audience, we don't read a book in December. We're back in January. December is recharging and rest and enjoying your families.
So
And
important.
so happy holidays to everyone. And thank you so much, Dr. Blackstock. And I'll be in touch.
Please do.
Thank you.
Bye.
Bye-bye.